Welcome to Alumni Takeover Week. My name is Lisa Hansinger, and I'm the Associate Director of Counseling and Career Education in the Career Center. Throughout this week, we've invited alumni to join us for conversations about their careers to give you insight into different career paths and industries, as well as get advice on how to enter and thrive in these fields. Our guest today is Sophia Pringle. Welcome, Sophia.
Thank you.
I'm going to tell you a little bit about Sophia and her background, and then we're going to get started with some questions. Sophia is a recent graduate of St. Joseph's University, where she earned her Bachelor of Science with a double major in Health Sciences and English. Sophia currently works as a patient coordinator at the Center for Surgical Health at Penn Medicine, where she plays a key role in managing patient care and coordinating surgical support services. She is also a first author of a published article in Supportive Care in Cancer, Tackling Transportation Barriers in Oncology. Sophia's passion for health equity and service shines through in her work. Welcome again, Sophia.
Thank you.
So just to get started, could you just real broadly share with us a little bit about your current role, what your responsibilities are, and what a typical day might look like for you?
Sure. Hi, everybody. I work as a patient coordinator with the Center for Surgical Health, like Lisa mentioned. The whole basis of the program that I work for, the surgical support program, is to train personal patient navigators who are volunteers. They're typically med students, undergrad, post-grad, some are even staff members as well. And they provide these surgical support services to patients within our community. My core responsibilities are, to conduct the initial screening of patients through intake calls. I develop and lead the trainings for our personal patient navigators as well. And I support the navigators in their roles and more generally oversee the patient caseload that we have. In a typical day, I come in and answer emails. Sometimes those emails are helping to coordinate, signatures from our referring providers, or pulling charts from PenChart, the electronic medical record system. And then I usually see if I have any outstanding tasks. Part of what I do in my role as well is to coordinate transportation for patients to and from their appointments. So sometimes it's putting in a voucher to the taxi company or getting together a parking pass for a volunteer to come and pick up. And a large part of what I do is conducting patient intake. So I usually spend some time each day calling patients on the phone to see how best, our services can help them. We also have weekly subspecialty meetings to go over our caseload of patients. And so those happen Tuesday, Wednesday, and Thursday. So around lunchtime every day, I am in those meetings hearing about our patients and seeing, how they're moving along in the process and how we can step in to help. And somewhere in there, I also find time to still talk to my coworkers. So go grab a Starbucks. So it may seem like a busy day, but there are a lot of things where I can still time and space for me to connect with my coworkers.
Amazing. I can tell just by the way you're sharing this information, you really enjoy it.
I do.
Like all different aspects. So that's really exciting to see. So I'm wondering, I know with a double major and seemingly unrelated, I'm wondering how your major influenced, this career choice and how you actually chose this career, or did this career find you? Like, can you talk about how this unfolded for you?
Yeah, sure. When I set out at St. Joe's, if you would have asked me freshman year, even going into sophomore year, I would have told you I wanted to go into physical therapy. You would have
Ah,
talked to me junior year and senior year, I would have told you I wanted to be a physician assistant. So I kind of did have when I set out, I had more of a clinical route that I wanted to go on. But as time went on, and as I took more classes at St. Joe's and the health science major in particular, I realized that I started to see another side of the health world that I was really interested in. I also did a summer research program here at Penn. It's called Summer SUMR in 2022 that allowed me to be a research assistant on two separate health services research projects. And that really opened my eyes to the world of public health. And going into senior year, I think I really definitely knew I wanted to do something more like this. And at first in my mind, I was going to try to do both. Um, but I ended up doing a post-bac program and realized that my heart really wasn't in it. And I was really still longing for that public health world. And so I found this job, and I've really learned that this is what I wanted to do more hands-on. Yeah.
Okay. And can you talk a little bit about how you picked up your English major? And,
Sure.
and if, you know, if that influenced your choice at all or
Yeah.
how that played in?
Freshman year, I took the intro to English class that all of the first years are required to take. And I really just fell in love with literature, reading, thinking about things more critically, and also like writing creatively. So the professor I had at the time asked me if I ever considered it, and I said no. And she said, "Oh, you don't have to do very many classes. Like, you should really think about it." And I said, "I've thought about it, and I'll do it." So I added, and I really enjoyed it. I think sometimes it feels like the English doesn't really, work in my world now, but I feel like I'm using it every day.
Yeah. I mean, you have a published article, so I would
Yeah.
say that some writing is involved in that, right?
Yeah, yeah.
So amazing. Um, I'm curious on this particular role or your idea for your future. Like, is future education on your radar at all? And if so, what would that look like? Like, I know you mentioned PA, PT. Obviously, that has you know, additional education, graduate education correlated to it. But what are your thoughts on that?
Yeah, at the moment, I recently applied to Penn's Masters of Public Health program,
Oh,
and
wow.
I was recently accepted and accepted my position in the program with a merit scholarship. So I'll be excited to be starting in the fall.
Oh, wow. I didn't know I was asking a question that was
Yeah.
so relevant. I thought I was sort of just aiming high, big picture
Yeah.
kind of stuff, but you're already on the ground doing it. That's
Yeah.
amazing.
Thank you.
Um, what do you feel like if anything, has surprised you about this role? And just to be clear, you graduated in 24, correct?
I
Or
graduated in 2023.
2023. So you've been on the job now a year plus.
Yes, I'm just a little over a year now.
Okay.
Um, yeah, I think the thing that has surprised me the most, I think it's one that's a little bit bigger and one that is probably a little bit smaller. The first being, I think when I was in undergrad, jobs to me seemed really like scary and like this place you can go and like you're almost like a shell of yourself when you're there. And I think the most surprising part has been like you can go into a job and like really be yourself, and still be professional and be able to kind of manage both sides of yourself. Um, I had always thought maybe it was television or movies or maybe what I had heard from the adults when I was growing up that like the job world is so serious, and it is very serious and there's a time for professionalism, but I'm able to really be myself. And I think that is so important. I think the other thing that I learned is the importance of email. I did not realize how important answering emails, sending them, how important it is in this world. So that was something I wasn't used to at St. Joe's. If I had a question, sometimes for a professor, I would just stop by their office and they were there. And there's no space for that here. Sometimes people are all over. So it is so important to send an email, yeah, and be timely in your response as well.
Wow. Thank you so much for sharing. Both of those are such great pieces of information for students to hear because I agree. I think a lot of them do think like, what's that going to be like? I have to give up myself and go to work for this company and sell my soul. But,
Yeah,
I think you just found, and as we encourage everyone to do, a good fit where you can be
exactly,
yourself and you're giving the best parts of yourself to this role as opposed to the opposite, which is leaving those at home.
exactly.
So amazing. And the communication via email is so critical, right? That takes
Yeah,
seconds. And yeah, it's very efficient, but we do encourage students professional, With the
Exactly.
subject line,
Exactly.
appropriate greeting. Hello, good morning,
Yeah.
Dr. So.
Having a signature, all of that, that really matters.
Yes, yes. So thank you, especially for sharing those. Could you walk us through the process of actually finding this position? Where you saw it posted? Was it through networking? You mentioned you were a summer intern in a Penn program previous. So, just how you found it and landed the role.
Sure. I kind of when I had did my post back and I realized that I think I just wanted to go into the working world and see how that was for me instead. I started looking. This job was posted on like my careers at Penn. I had looked at LinkedIn and really hadn't found anything. So I was like, let me really narrow my search. I kind of knew I wanted to be here at Penn. I had worked here previously. It's very close to my house, so I was looking to be around here. And so I saw that the listing, I think, had been posted for like 13 or 15 days before I had saw it. So I made sure to put my application in right away because I knew that I didn't want it to go on too long and the job to slip away. And I had about 5 rounds of interviews. I know sometimes
Wow.
that I met everybody that was a part of the team before I got here. I know that's not typical and it is a little bit unique to the organization that I work for, but I have had friends, who have done 2 or 3 rounds of interviewing, which does seem to be about the average. So I
Mhm.
had those interviews and was offered the position.
Amazing, amazing. So okay, I'll get to that one in a minute. I don't want to give too many things away.
Sure.
Um, I'm just curious about the DE&I aspect of not only Penn, but where you are, sort of a hot topic these days with the current political climate. And I'm just wondering, how Penn demonstrates a commitment to that and, whether that plays out in your day-to-day work.
Sure, sure. I think my day to day working in the public health world, public health is honestly really DI is at the core of all public health work. A large part of public health is protecting communities and trying to improve quality of life and overall health and health outcomes. Whether that be through research or policy or programs like the one that I work for. And the organization that I work for, Center for Surgical Health, they we recognize that there are a lot of barriers within our society that don't allow for healthcare, more specifically surgery, to be accessible and sustainable for everyone within our community. And so we work within this space with the ultimate goal of creating a world in which all individuals are able to have the tools and opportunities to, access and attain their highest potential for health and well-being.
Okay, great. Yeah, I was really interested in the topic of your publication too, with the
Yeah,
transportation. Like people don't think about that level of detail always, but that can be preventing someone from getting care.
yeah. If you don't have a way to get there, if you don't have someone that can, be there with you, especially like on surgery day, like if you have to have somebody there to be with you, and you have to have a way to get there. Sometimes surgery is that you have to be here at 5, so
Right, right.
transportation can really be a barrier for a lot of folks, and we're really trying to break down those barriers so everyone has access to surgery and the care that they need.
Amazing. So I'm gonna shift gears a little bit, take you back a year or two, and think back to your time at St. Joe's. Is there something, is there anything you wish someone had told you? Either about this role, about your one of your majors, both of your majors, um, anything that you can share about, wow, I wish I knew that when I was still a student.
Yeah, I think I and s- I wish someone had. I think someone had told me, but I wish they would have, drilled it in me just a little bit more. Was this idea that like any opportunity is a good opportunity?
Okay.
I think I think there are some opportunities that may not feel like they're the best fit for you when you're an undergrad and you're like, oh, I don't really want to do that, or that isn't in alignment with what I see for myself. But I think if you go into any opportunity with a clear mindset and a positive outlook, you really know, you never know how it will turn out for you.
Oh, that's great. Great advice. Yes, thank you. And so true. You know,
Yeah,
once you get out there, you don't know what you don't know.
yeah, exactly.
So, so staying kind of back in your college years, what a couple of ideas of experiences that you would recommend students engage in while they're still in school, if they were interested in pursuing, something in public health, something similar to what you're doing. Do you
Sure.
have any suggestions?
Um, I think the first one that I would suggest would to take on any type of leadership role. I did have a few leadership roles when I was at St. Joe's, and I think they taught me so many lessons about effective communication, honestly about a lot of different things that I wouldn't have learned in any other kind of way. So I do think if you have the opportunity to have a leadership role, even if it may seem small, those roles are so important and they teach you so many valuable lessons.
Hmm.
I would say the second thing I would encourage everybody to do is to volunteer. That was another space where I think I ultimately, learned what it is that I wanted to do and how I wanted to impact the community. And there are so many opportunities for volunteering at St. Joe's that even if you're able to just do one a semester, that is such a great opportunity for you to give back to your community and really get that feel good feeling.
Oh, yeah. Can you give an example of a leadership role that you had and also a volunteer experience just to give students ideas?
Sure. When I was on campus, I was a publicist for the Black Student Union. At one point, I was also, my senior year, I was co-president with my best friends. That was very fun. And then volunteering, I volunteered with the Herd group on campus. They're a group of women, and we go over to, well, I'm no longer in that group. They go over to Gompers, and they have a once a week meeting with the 7th and 8th grade girls, and that was so meaningful to me. It really reminded me of when I was younger, and I learned so much from that. I ended up also having a leadership role within that volunteer space as well, and kind of passing along information to the other volunteers and being the person that coordinated between our group and the teacher liaison over at Compers. So there are all types of opportunities for leadership and very many opportunities for volunteering as well.
Yeah, thank you for sharing that, just so that students know that doesn't matter, like you said, how big or how small. You did end up as co-president of BSU, but didn't start that way. So,
Exactly.
you don't always have to be quote unquote the president,
That's
um, you
exactly
know,
right.
to gain those skills and qualities. So
Exactly.
great. Um, are there any classes that you felt stood out to you as being particularly helpful in preparing you, again, for this role or just being a professional working in healthcare?
Yeah. I we spoke on it a little bit earlier, and I was actually speaking with someone more recently, and they asked me what kind of things do I do with my English major now. And I remember saying back like sending this text, and that is probably funny, but I'm using it right now to speak to you. I think my English major and in my English classes, it allowed for me to really think critically about text. And then I think in my life, I'm thinking more critically about situations and the places that I'm in. It allows me to, articulate myself well and really think before I say something, and like I said, it really just allows me to think outside of the box and be more creative. So I am very appreciative of having the English major and taking English courses.
Yeah, great. And again, we do get a lot of English students too, like, oh, I love my major. I really want to stay in English major, but what am I going to do with it? Anything.
Yeah, so many things.
Yeah, but thank you for sharing directly how that's impacted, your current role and how it can positively impact anyone in a professional role.
Yeah.
Um, being in the job market right now, there's always trends and hot spots and that type of thing. Do you have advice for students that are, will be graduating, looking at different roles in our area? Any just general tips about the job market?
I would say when I was applying to this job, I didn't, I only applied to a few other roles, but anything that I felt like I had the capacity and capability to do, I was applying for. I know I said it earlier, but honestly, any opportunity is an opportunity. And while it may not be, in the field that you are particularly interested in, I think that can open, a new world for you. Um, so I would say if you see a job and it seems like you're able to do it, it is worthwhile to apply. You really don't know that you don't like something until you try it. So I would say give it a go.
Yeah, great advice. Because the job description only takes you so far.
Exactly.
And if you like that, that's a good first step. But if there are things that you're like, I'm not so sure about, it's still worth pursuing.
Yeah.
And all of us need a reminder like that. So thank you.
Yeah.
Just because you think, nah, that's not for me, or that doesn't pay what I want, all
Yeah.
these things, it's easy to rule that out. But I
Yeah.
love that you're like, open yourself to that opportunity, give
Yeah.
yourself a shot. Um, I'm wondering about, if you feel like the Jesuit education, or how the Jesuit education in particular has impacted how you personally like approach your work, um, and or like the career decisions that you've made. Like, do you hear that voice in your head sometimes? Like, oh, wait, this is what I learned at St. Joe's and Cura Personalis and all of that type of thing.
I do feel like that's true. I think the concept of a whole person, education and seeing an individual as being, multidimensional and having all these different facets of themselves has really painted the way that I see the world. And I feel like I go around looking at world in that same kind of lens. And that's how I see, others, especially in the work that I do. We have so many parts of ourselves. And I do feel like part of that, having that mindset was because of being at St. Joe's and having a Jesuit education.
Yeah, and I love, specifically the field that you're in, um, is an opportunity to see the whole person.
Exactly.
And in healthcare, obviously, to provide that care.
Yeah.
So that's a great link to what you're doing. Um, any type of internships that, either you personally engaged in or you see others have done that are peers or in your organization that you think would be helpful for students to pursue, if they're looking at a career like in public health?
Sure. I can speak to the summer internship that I did. That was, the place that I really sparked my interest in health equity in particular. Um, and so that was, the summer program, SUMR at of 10, like I mentioned before, summer undergraduate mentored research. They recently changed the name. And I was never really interested in research before. Um, but I do think being in that program, it opened my eyes to research and, what that can look like. And, I'm thankful to that program. I was able to have a published paper from that. So I would, encourage people to look at things like that. Like I said, there are so many, opportunities and internships out there. And while it may not be, in the field that you're in, um, all of these opportunities are a space to network and get to know people. And so you never know, going through that type of thing, the connections that you can make and the people that you may meet, and how that will allow you to either grow in your career and honestly just grow as a person.
I'm really glad you mentioned the networking word, because that was the next question.
Yeah.
So thank you for a perfect segue.
Of
Um,
course.
how do you feel like that has influenced, or has it, you landing this role or even getting the summer? It, do they pronounce it summer?
Summer, yeah.
Summer, even though it's abbreviated, not the same spelling.
Yeah.
Um, you know, how has that helped or not helped? As you know, it tends to get sort of a negative connotation among students, like, ew, I have to network. They're not sure what that means, what that looks like. It feels phony. But if you could just speak to that topic a little bit.
Sure. When I was in undergrad, I think it might have been an advisor, maybe somebody in the CID. I can't remember exactly. Um, they told me that like if I see my day-to-day interactions as networking, that interacting more professionally, it's not as scary. And it's not to say you
Mm,
have to go into every conversation feeling like you're networking, but I can remember being in Campion or in the CID with my friends and mentioning that I had this idea, or speaking to an advisor or professor and saying I had this idea, and they're like, oh yeah, this other person had the same idea, you guys should connect. And I think having those more personal networking opportunities um, really made it easier in a professional sense to be able to um, form those connections with people.
great. I love that analogy. Just like, you know, look at every situation, just like you're interacting. I say to students, like, have you ever asked anyone, what's a good Indian restaurant? Like that's networking.
That's networking. Everything is networking if you think about it. It's kind of weird if you think about every conversation you have as being networking. But if you really think about a lot of the conversations you have on a day to day, it can't, it's a form of networking.
It's a form,
Yeah.
exactly. And there's a lot of different forms, and some you would want to be naturally a little bit more professional and polished than others.
Yeah.
But it is communicating, right?
Yeah. That's exactly.
So no, I love how you sort of, brought that into down to earth for the students that are tuning in.
Yeah.
Um, yeah, so that's all the formal questions that I had. Um,
Great.
I know that we had one question in the Q&A, so let me pull that up. Gianluca is wondering, do you think it would be advantageous to declare a business minor along with a health science minor? I'm, I'm thinking he might mean major. But what do you think of the combination of health sciences with business?
I
Would that be
I
helpful?
think there's always a space for business in honestly any field. I think that kind of trajectory can really land you. It could land you in the public health field. There's always space for that kind of business mind. That can also even push you into more like healthcare administration, where you might have a leadership role within the hospital and kind of help with that. I think that would be, if you're interested in it and you have the bandwidth to do it, I think that is really great and can open you up to a lot of different types of opportunities.
Okay. Just a follow up to that. Are there any of your colleagues that have a more of a business background and they've applied it to healthcare?
Um, yes, we have somebody that's on our team. They're a part-time member, I believe. She does have her master's in healthcare administration, and she works with our organization. Um, So there is a space for, even in like the public health world and community health work, there is a space for that type of background. There's a space for business background in just about anything.
Great. Yeah, and we'll tell students too, you can apply those to different fields. Then when you get there, as you're doing,
Yeah,
you can narrow it a little bit more with the graduate degree.
yeah, exactly.
So great. There is another question. Elena's wondering, what is the most rewarding part of your job? Great question. I always love to ask that.
That is a great question. I think the most rewarding part of my job is seeing patients, especially because I'm the first person they talk to when they're introduced to our organization. I'm conducting that intake call with them. I think seeing them, um, speaking to them on the phone and seeing them all the way through to surgery and having a successful surgery and all the way to post-op, that is the most rewarding part for sure. Um, just being able to know that I had a very, even the smallest part, and then being able to really achieve their highest form of health is really the most rewarding part for sure.
Great. So I have a couple follow-up questions to that.
Sure.
I'm wondering, like, the length of that process from when you first meet them. I guess it varies, but generally then when they're leaving
Yeah,
surgery and
it totally depends. I know we were just speaking about the more business side. So in order to be seen by any doctor here in the United States, for the most part, you do have to have some form of insurance. Typically a lot of our patients don't come to us with insurance, so we help them, our navigators, help them through that process. Typically, if, when we're applying for assistance, um, we try to have people, 4 months, 5 months, but there are some people who are with us for a long time. They face many barriers. Sometimes we get pushback from the Department of Human Services, with insurance applications, or, there are just a lot of barriers. All of our navigators just demonstrate so much patience and hard work and diligence with our patients. That is another rewarding part, is seeing so many of our volunteers just work really hard because they, really care for their patients, and they develop such great connections with their patients. So it honestly, like you said, it really varies. If a patient came to us and they already had, insurance and just wanted somebody to attend appointments with them and be there with them, that process may be a lot shorter than somebody who is applying to the state for coverage. And that could take a while. But typically we try to, have application in soon, and they could take around 30 days for a response to come back, either as acceptance or denial. And then if we have an acceptance, we can move forward with scheduling a pre-op appointment. And if there's not a denial, we are figuring out why. Are they over the income limit? Did the documents that we submitted not get uploaded? So there is varying levels and time that are spent with our organization. And I think it's a great testament to how business does work in the healthcare field.
Right, right. Yeah, it sounds so rewarding, like the whole job sounds very rewarding.
Yes, it's very rewarding.
So, do you have a sense of how many patients you have at any given time?
I can, if you give me one moment, I can let you know
Oh,
right now.
yeah,
um,
ballpark, Sophia. It's fine.
at the moment, we have, I think, just a little over 100. Um, Currently, we have active 173 patients.
Wow. Okay.
Yeah,
That's a big number.
it is a big number.
Yeah. We have another question that just came in. And Trish says, it sounds like the navigator role you've referenced is a volunteer position. Is there a way for students to get involved as a volunteer in this role?
Yeah, we do have volunteers. Our undergraduate volunteers, I do believe, are limited to being here at Penn. They are juniors and seniors as well. So that is the makeup. It's always worth, if you are interested in navigating and being a navigator, you could connect with me on LinkedIn, and I could see how I can help you to get connected. But I do believe at the moment our undergraduate positions are just limited to those who are here at Penn.
To the Penn students. Okay. Yeah, thank you. But it helps to network.
Yes, it does help
Back
to
around
network.
to that topic.
I can always see what I can do to help.
Yeah, exactly. Exactly. And when students are just really willing to contribute, and as well as gain exposure and experience, it seems like it might be worth pursuing if someone is very interested.
Yes.
So great. Well, I don't think, unless students, if you have any other questions, feel free to type them in the Q&A. But other than that, I want to say thank you so much for giving your time to us this morning, Sophia. Information was just fabulous.
Of
I hope
course.
that the students listened, learned, and took notes. I know I've taken some mental notes myself. Very grateful for your time and your insight. And as you know, you're always welcome back on Hawk Hill.
Thank you.
So hope to see you soon. And for those of you tuning in, just a reminder that we have additional alumni takeover week sessions going on. Tonight we have an in-person, our only in-person session at 5 p.m. And Ryan Howard of the Eagles Autism Challenge will be presenting in Campion. So please check your email for details on that. And thank you all for tuning in. Have a great day, everyone.
Lisa,
Oh, I'm
there's
sorry.
one other question.
I just saw that pop up. Sorry. Um, one last question, Sophia, before we sign off. What was the hardest part of your job search? And what advice would you give? This student is in their last semester and is having some difficulty with their job search.
Yeah, the hardest part of the job search, um, I think was finding jobs that I felt like I was qualified for. I think sometimes if you're looking, they may say, they want somebody who has, a higher education level or something like that. So I do think the hardest part was, finding a job that I felt like I was qualified for. I do feel like one of the better advice I could give would shoot your shot. You never know what's gonna happen. And I also would say make sure that your resume is up to date and having somebody, look at it and make sure that it's concise. I think especially if you're applying to a job that has 50 or 70 other applicants, might be the only thing that they're looking at. And so if that presents well, then you present well. So I would make sure that your resume is up to date and looks good. I think at the Career Center, you guys can help out with that. Or even just having, somebody that who's in a job that you like or would aspire to be in, just look at your resume and make sure it's up to date and applying to as many jobs as you can. You never know what you may be qualified for.
Right. Yeah, no, I love that. Yeah, thank you for sharing again.
Of course.
So, all right. Well, thank you again, Sophia. It was great to catch up with you and learn about your current role. And I wish you all the best and stay in touch.
Thank you. Bye, everybody.